stress is a part of our life. I think to have the goal to eliminate stress from our life is pretty much impossible. And I suppose rather than trying to eliminate it or to avoid it, you can find practical ways to manage it and ensure that it doesn't take over. And I think that's exactly what we're trying to do with this programme, is to give, the general public practical tools to balance stress in their lives.
Welcome to the HSE Talking Health and Wellbeing podcast. Today we're exploring a topic that affects all of us, stress. Whether it's work, relationships, or just the challenges of everyday life, stress is something we all experience. But managing stress is possible, and today we'll be talking about how you can do just that with the HSE Balancing Stress programme. This free, evidence-informed programme is designed to help you better understand stress and give you practical tools to manage your anxiety, low mood, and relationship challenges. You can take part at your own pace, in your own time, on any device. To help us explore how balancing stress can support you, we're joined today by two experts in mental health and wellbeing. Dr. Niamh Clarke, Principal Psychologist. Thank you very much for joining us, Niamh.
Thank you, Noreen.
And Dr. Alicia Clarke, National Programme Manager for Mental Health and Wellbeing. Thank you very much for joining us, Alicia.
Thanks, Noreen.
So this is really exciting because this is a new balancing stress programme that the HSE have launched, and it's taken quite a while to get here with many people. I suppose just to start off, to set the scene, Alicia, do you want to just tell us what the Balancing Stress programme is and why we created it?
Absolutely. So Balancing Stress, it's a freely available online stress management programme that's been devised by the HSE, so a partnership between HSE Psychology and Health and Wellbeing. The programme, it's designed to help participants firstly to recognise stress and secondly to equip participants with the tools to manage stress in healthy ways. And we do that over the course of 6 sessions. So each session is approximately 35 minutes long, and each session covers a core element of stress management. So I suppose in terms of why it was created, Noreen, I suppose throughout our lifespan, we're faced with many, many stressors. Things like some of the big ones being financial strain, time demands, relationship difficulties, loneliness, isolation. And we know from research that it's often the build-up of stress over time that can have a real impact on both our mental health, but also our physical health. It can impact on our relationships and our overall quality of life. So I suppose from a health service provider perspective, it's really important that we provide prevention and early intervention supports at a population level. And when we look at what's effective in terms of prevention around stress management, there's really good evidence that online, low-intensity psychological interventions, which are based on cognitive behavioural therapy, can have a really positive impact on both our mental health and on our wellbeing outcomes. So really, it's for this reason that we set about developing the Balancing Stress programme over the last number of years. And I suppose just one other point, the online element is really important to us from the point of view of scalability and ensuring that we can provide a stress management programme that's accessible to all.
Okay, that's brilliant. And it's free, which is fantastic. So Niamh, who would you say should really come online and have a look at this and see, is it for everybody or is it just a certain type of person?
Well, this programme is for everyone and anyone, Noreen, because we all experience stress, as Alicia's just said. Stress, if we give it its technical definition, is defined as the mental or emotional strain. And unfortunately, throughout life, we're faced with multiple stressful challenges. For some of us, it can be just a single stressor, but that stressor may be profound on its impact on us. And for others, it's multiple stressors. So to answer your question succinctly, there's something in this for everyone. We would say if you want to use it at work, if you want to use it just for your daily living, if you want to give it to friends or family. And because each session takes a different topic and explores it from multiple angles, I think there's something in it that will be of benefit to all.
Okay. And Niamh, just going back there, you said stressor. What's a stressor?
So a stressor is anything that causes us stress. And what might cause me stress may not cause you stress. So this is why stress is so difficult to nail down, and yet it's so pervasive. So for me, it might be an interview that might cause me huge stress, and somebody else would see that as an opportunity to showcase themselves. For some, you could even have positive stresses, would you believe? Moving house, the birth of a baby, how wonderful are all of these lovely events, going on holidays. but they do cause us stress. And what I would say is that they're big ones, as Alicia said, financial pressures, relationship problems, work and illness is a profound stressor. But smaller things cause us stress, like traffic going to and from work, a loved one who doesn't seem to be themselves. Stress is everywhere. And what I say to you, Noreen, is that we need to also be kind to one another and we need to not dismiss it. So when somebody says, I think or I feel I'm stressed, this program is a really good starting point. So it can be used as a starting point on your journey to help, or it can be used for information purposes.
So there's many stressors, of course, but how would somebody recognise if they had stressed? Or how would I know if I'm stressed? What would I feel like?
Well, stress is felt in every part of the body. And we always say in psychology, it's often our body, which is the first part of our actual physical body, gives us the first symptoms of being stressed. But it impacts on our thoughts and our feelings and our behaviours.
Okay.
The body is there to react and to tell us something, is happening. And with a stress, what happens is, or with multiple stressors in the body, this is where we often see the first signs. So that can be felt as headaches, rapid breathing, tiredness, fatigue, unable to sleep, sweating. And all of these in their own right can become a very big problem. If you put them all together, you can see how quickly it becomes very debilitating on the body. For some people, it ends and begins with the body, and others then it's their thoughts that are more impacted. So this is when we tend to focus more on the negative. We are more critical of others and ourselves. We have worry thoughts. Intrusive thoughts are a huge problem with stress. All of these causing severe impact on any individual.
Okay.
And if that wasn't enough, Noreen, that your body and your thoughts are impacted, your feelings and your behaviours are also impacted. So you can become very sad, you can become irritable, you can become angry. And then because your thoughts and your feelings are impacted, your behaviours are impacted. So some people retreat, some people get angry, some people get louder, some people kind of fade into the background and don't want to be communicated with, when in fact that's exactly what needs to happen, is that somebody needs to reach in or they need to reach out.
Okay.
So I think if you were stressed, Noreen, which you are, because you said you were and we all are, stress, it'll be very clear. It'll manifest in some part of our body.
Yeah. Okay. And that's really good to know, because the signs and symptoms, sometimes we don't recognise them. So Alicia, Niamh has told us how to recognise all of these signs and symptoms of stress. So how does this programme then help us deal with all of that?
As I mentioned, there's 6 sessions in the programme and Niamh delivers the programme. We're really fortunate to have Niamh as our presenter. The programme, it's self-directed, Noreen. So this means that you can access the programme whenever you like at a time that suits you. And each one of the sessions are independent of each other, but they fit together as a programme as a whole. So just to give you kind of a flavour of what's covered in our 6 sessions. So our first session is called Understanding Stress. And this session is all about helping participants to recognise how stress impacts on their daily functioning and why it's important to manage it. So touching on some of the points that Niamh has mentioned. The second session is looking at managing worry, because we know that worry can really take over when we're feeling stressed. So here we start to look at trying to identify and challenge some of those negative thinking patterns that Niamh has mentioned and trying to replace them with more balanced, realistic thoughts. Then our third session moves into managing anxiety. So as part of that session, we break down what we mean by anxiety, and then we look at some of the ways that we generally tend to manage anxiety, which can often be quite unhelpful. And we try to look at how we can replace that with more effective coping strategies, such as facing our fears. Our fourth session then moves into managing low mood and depression. And as part of that, we look at a particular strategy called behavioural activation as a way of managing that low mood and depression. So that's about trying to engage in enjoyable and meaningful activities to counteract stress. Our fifth session then looks at the impact that stress can have on our close relationships. And we know that this is very common in terms of stress. And in addition to looking at how to take care of our relationships when we're feeling stressed, this session also looks at how we can cope when we're worried about somebody who is very close to us that's feeling stressed. So what are the things we can do to look after both ourselves, but also our loved one who's feeling stressed? And then our final session is a wrap up really of the course as a whole. And then it looks at really how can we manage and balance our stress into the future? So what are the things that we can put in place into our everyday interactions and our everyday livings that can really help with stress.
So in one way, it's a balancing stress program, but you can nearly find there's something in it for everybody, no matter what situation you find yourself in. I know it's a HSE program. It's evidence-based, isn't it?
It's a universal kind of primary prevention. I suppose we use two main psychological models, and this is where you get your evidence base. And the two models that we use throughout this program is CBT. And I think people are familiar with this, cognitive behavioral therapy. It's often very talked about talk therapy because what it does, it's a proven, effective technique to help reduce stress and mental anguish. So it's very effective in the treatment of depression, anxiety, and stress. So I think the other second model that's used in the sessions is positive psychology. This is probably less well known about because it's a more newer form of psychology. And what that does look at is human flourishing and the strengths of an individual. It tends to focus on what makes communities flourish and what makes individuals thrive. So words like you will hear looking into people's strengths, looking at gratitude, the importance of savouring, the importance of kindness, random acts of kindness. People may be familiar with that. So the fact that this whole program is built on two proven psychological strategies means that people can go back to it and know that what they're listening to and what they're being taught about is clear, it's evidence-based, and it's safe because people want to know where that they can get safe material and what works. And these are two proven strategies. I think my colleague Alicia there was talking about, partnership. And I suppose the other side, it's written by HSE, psychologists and health and wellbeing practitioners. The two work really well together. We know that psychologists look and study the mind and the behaviour and how to support people. And that dovetails extremely well with our health and wellbeing colleagues who are concerned with enhancing the mental health and wellbeing nationally. So it made good sense for both psychology and health and wellbeing to come together to write this programme because both are invested in supporting the population of Ireland as a whole.
And Alicia, so the word stress is out there, if you know what I mean. People use it all the time and maybe we use it inappropriately sometimes. Oh, I'm so stressed, when people maybe aren't stressed. So what makes this programme different to any other stress programmes that we've seen that come up on our phones or our devices? Like
Yeah, I think you're right. There's a huge amount of information out there online in terms of stress and stress management. And that is a good thing, but at the same time, sometimes it can be quite difficult to navigate our way through that volume of information that's online. And I suppose it's not always clear the kind of psychology or evidence base that's underpinning some of that information. So I think what makes our Balancing Stress programme different is, first of all, it's an Irish programme. It's homegrown. Yeah. It's developed by a team of experts, as Niamh has mentioned, from psychology and health and wellbeing. But in addition to that, the programme has gone through several rounds of peer review. So it's gone out to external psychologists who have reviewed the content and have helped us to refine the content even further. Also, we, as part of the development, we went through a number of rounds of user testing with members of the general public. This was hugely important because it gave us a much better sense of how the content was working for the general public. And also, just thinking about how we present the information for the general public. I think just one other point, Noreen, a unique element of our stress management programme is the provision of additional insights at the end of every single session with Professor Alan Carr from UCD. So at the end of every session, Niamh interviews Alan Carr, and here he shares real-world insights from his practice. So he shows us how the strategies that Niamh has talked about in every session, how they work in practice with the clients that he's worked with. And I think this is incredibly inspiring and really uplifting. It's kind of just a great way to kind of finish each one of our sessions.
Yeah, so that's brilliant. So from the very beginning of the design stage, then you had like people involved in, rather than us telling them what they should be told, we're telling them what they need to be told, if you know what I mean. Because I think so much times in healthcare, we just give people information that we think they should be told, but we're getting much better at that, aren't we?
That's right. Absolutely. Yeah. And I think it's also important to say myself and Niamh are here today talking about the programme, but it's been a team of experts that have been involved in developing not just the content from psychology, but also from a design element. We've been really fortunate to work with HSE Spark Innovation and a team of designers who have helped us in terms of that online design element to ensure that the program is as engaging and interactive as possible.
And sometimes it's very difficult to make things less complex and make them look really simple, and then nobody really understands the complexities behind you actually got it to look so simple and so practical,
And just on that, we started out with 6 90-minute sessions back in the day, and we really thought that that's what was needed, that volume of content. But through our feedback from users, and also when we look at the research around user engagement with the online programs, we can see that that's, there's a sweet spot around the 35 minutes in terms of engagement. So it was up to us to kind of refine that content, which can be quite challenging because, there was no end to the amount of content that we wanted to provide.
Information that's out there.
Yeah.
And I know that you're going to be, and we'll talk about it a little bit later, that this is constantly going to be reviewed and you'll have research and everything. But Niamh, say somebody comes on and we're going to give them practical tools and techniques, and people will be able to take them away with them and use them whenever they need them. So what's an example of some of those tools that we might be telling people about?
Okay, so as Alicia said, each session is built around, I suppose, the theory and concept for that session. So if you take anxiety, if we take that as an example of one, or understanding worry, what we do then is a technique that's very, very useful when you're looking at understanding worry is to challenge your thoughts, because people believe that their thoughts are facts. And in fact, they're not. But your mind repeatedly tells you a piece of information, and therefore this becomes your mantra. So each one of the sessions that we have gives a new and workable and manageable solution to help the most common symptoms of that presentation. So if we look at worry, we talk about problem solving. If we look at understanding anxiety, we look at the symptoms, but then to helping people face their fears, because people often get stuck in and kind of paralyzed in moving forward because they're so afraid to do so. But this particular session gives you strategies to do so. If we look at relationships, communication is essential. And when we're stressed, that's the first thing that suffers, the ability to communicate effectively. And it goes through it step by step. Empathy. How do we display empathy? How do we allow ourselves to receive empathy from others? Making time for others. It sounds very straightforward, but when you're stressed, there's sometimes the most simplest, straightforward things that we would routinely do without having to be prompted. We forget how to do, or we stop doing those things. Connecting with others, social prescribing. Even managing stress into the future, because often it's like with other things in life, as soon as you get it under control, or as soon as you learn how to balance it, then you stop practicing the strategies that work. And I suppose I'm always surprised that people don't, we forget, including myself. I'm often surprised at myself that we don't give ourselves time to work on strategies. We don't put ourselves first. And the last section is particularly good at this, where we actually learn how to savor. We learn gratitude. We learn, what does kindness really mean? Kindness to me, to my family, to my friends, but generic kindness. What are my strengths? Because we all have strengths, Noreen, and yet sometimes they fade into the background because our troubles are so much in the foreground. Yeah. So learning about our strengths and really savouring them. My strength won't be your strength, but me appreciating your strength and you mine will lead to a much, healthier relationship for ourselves and others.
Yeah. And Alicia, do you want to add to that one?
Just when you say that, Niamh, it's so interesting. I was reading a quote from Michelle Obama at the weekend where she says, we need to do a better job at putting ourselves higher up on our own to-do list. And I think that's exactly what you're describing there. And that's what the Balancing Stress program is. It's about giving ourselves the opportunity to put ourselves that bit higher up on our to-do list and put in place strategies to support ourselves.
And Alicia, you don't need to be stressed to do this. You could do this program at any time. So is it better? Well, people can do it at any time, okay. But if you wanted to have a look at it, and then we all know there's going to be stresses in our lives, and then you can pull out these techniques whenever you need them. It's like something that you put into your back pocket and you just say, okay, well, this is a difficult situation and now I'm going to do X technique or whatever, my belly breathing or whatever. So it's something that you can carry with you throughout your life.
Absolutely. And we would really encourage that. It's not just for the times that you're stressed. It's actually, putting them in place so that you can, take them out and put them into practice when you have those stressful moments. And it's really about, the strategies that Niamh talks about in the program. It's about trying to kind of create that space to practice those strategies in our everyday lives, because it's just, as Niamh has said, stress is a part of our every life, and it's just about ensuring that we can use those strategies as best as possible.
Yeah.
And Noreen, we know that unless we use something, we lose it.
Yes.
And we're awfully good at, in the moment when we're very stressed, at looking and seeking solutions. But what Alicia's talking about is this program is very good for that when you're in acute state of stress. And we'll talk a little bit more about, for some, they may need other supports, but it's also about, at times when you're not stressed, how do I maintain this? How do I maintain a balance in my life? How do I look after myself? But for those that are acutely distressed and stressed, you have to be very careful at that point. If you've tried the strategies throughout the program, you've utilized them, and it might take more than one go at a session. For me, I like to review something, I like to hear it, and then I hear it again, and I hear something different the second time round. I jot down little notes for myself. Other people just like to hear it repeatedly. So whatever way this program works for you is what we would be encouraging you to do. And if you feel that after practicing the strategies, talking to others, talking to friends and family who might be saying, actually, I think you need some more help, we would say, please reach out to your GP. Wonderful resource in the community. And, to your psychologists and your HSE and your counsellors, they're there to help. We also have A&E. You're not alone. You're absolutely not alone. Your family are there beside you, your friends, but also there are resources with GPs, and in the community. That throughout this program, we say connection to people, whether that's through sport, through exercise, through things you like, chess clubs, to name but a few, bingo, if I was talking about my mum and her aqua aerobics. It's whatever you need to do to help you. But if you need that little bit more, and the balancing stress is a beginning, but doesn't see you through to the end, then we would say, go out to your GP, reach out, talk.
Yeah, that's really important. I mean, obviously your GP, if you're somebody who's in crisis, it's the first port of call. And Alicia, say if somebody feels they're listening to us now and they said, it's not going to help me, or, well, like obviously if somebody needs to go to their GP, but what would you say to people who are kind of feel a bit unstuck and just don't know if it's for them?
Yeah, I think no matter what age we are, I think we can all recognise that feeling of finding it hard to start something new, particularly I think when we don't know what's involved in it. I suppose what I would say is what's great about balancing stress is it's free. There's no need to sign up to it. You don't have to provide an email address. You really just have to click on the link. You Google HSE balancing stress, click on the link. What I would say, Noreen, is start small. You don't have to commit to doing all 6 sessions. For best results, we obviously would recommend that you do the 6 sessions over the course of a number of weeks. Don't rush it. But I would say start with session 1, and even perhaps just introducing one of the breathing exercises, the tension down relaxation technique that Niamh introduces at the start of every session. Just think about perhaps introducing that on a daily basis. And I suppose the other thing I would say is, think about when is convenient for you to access the program. Perhaps it's that, 30 minutes going out for a walk, sticking in your earphones, listening to the program. We would love...
That's another thing. People don't have to. They can just listen to it then as well.
Absolutely.
Which is fantastic.
Absolutely.
So, Niamh, Alicia's told us that how to start the Balancing Stress program, but are there challenges for people even starting this?
Yeah, I think a key message is that where to go for help and where to begin your journey. Because when we're stressed, you are so preoccupied with stress. And we've said already that our body's impacted, our thoughts are impacted, our feelings and our behaviours. So it's all consuming. Our stress can be all consuming. So our key message, and that faces people, I suppose, when they're trying to manage their stress and balance their stress, is knowing to prioritise themselves, knowing to ask for help, get started on the programme. Don't expect instant success. Don't expect that listening to it once might be the panacea for everything. It's about listening carefully, practicing the strategies. We keep emphasizing practicing the strategies, and some will be more a natural fit for you. So the ones that are a natural fit, you might start straight away. And techniques, because about changing your mindset can be tricky, and it's hard because your mind is a very powerful muscle and will try very hard to convince you of other things. And when we're stressed, our thinking becomes disordered. So it is about giving this a chance, giving yourself a chance. And as Alicia has said repeatedly, we need to prioritize ourselves. So the hardest thing is to actually get started. So we would say, log on. The moment that you click on Balancing Stress program, it'll draw you in. And we hope that with each session being 30 minutes, it's not too long, and give yourself that 30 minutes. And it's broken up and it's kind of chunked into sections that will make it much easier to hold your attention. And therefore the learning should be much easier. We hope.
And you talk people through it, don't you?
Yeah.
And you talk people through the exercises. So they'll recognize your voice and you'll be able to talk them through everything. And, the people that I've been thinking about for this, as well as obviously students over 18s, maybe kids who are doing exams, and if we get them to do something like this earlier on in their lives, they can then pull it out whenever they need it. So I have 3 children just over 18. It's something that I would love them to have. Yeah. And like in schools or in colleges, and I'm sure in workplaces, Niamh, it would be a really good thing to get people to do.
And just like what you said, we would hope that balancing stress will become part of inductions, whether it be the guards, whether it be teacher training, the HSE. It doesn't really matter. But if it's part of an induction and you hear about stress, perhaps when you're not stressed, it is a really useful and resource, and people can go back to it. I live in the countryside in Westmeath, and we have a lot of people who work in isolation, that work on their own. We have a very big rural community, and even in the modern tech world, this is the balancing stress, because we know that stress impacts on everybody for very different reasons. And we would like it as part of an induction. If you're part of an organisation, we would like you to share the link with your cohort, that you say, look, this might be useful, maybe not today, but tomorrow, but have it in your back pocket. If we keep sharing it and talking about it, I'm part of a walking group, and it's often when we're walking and we're talking to one another that people share information. And if I'll share this with my friends when I'm walking and say, something you mentioned might actually be useful, it triggers something. So we would see it as part of induction programs. We would see it as part of routine health and wellbeing in organisations. We know that schools are particularly good with their health and wellbeing programs, universities. And this is something that can be shared. I was talking to sporting colleagues in the GAA. I'm a big plus for the GAA. I think it's a wonderful organisation. But you see athletes, you see those players getting stressed, and it's sometimes not easy to talk about it. But I think if we all made stress easy to talk about. And this program does just that.
And, I just keep thinking it's free for all of those organisations, and all they have to do is copy the link. And Alicia, what was the link that you thought that people should access the programme?
Yeah, so you just have to Google HSE Balancing Stress Programme, and then you can click on the link and get started on your first session.
Yeah, and we just invite everybody to share that. Now, we know that this isn't the be-all and end-all, and if people do need other information, then they go to yourmentalhealth.ie.
That's right.
And they can find out. And this is one of the tools. But if they want to go directly to the website, then they can do that also. So that's just fantastic. So what's next for Balancing Stress, Alicia? Because I think we've just started with this, really.
Absolutely. I was going to say we're not done yet. So I suppose firstly, research, it's a hugely important part of the work that we do. So we will shortly be working with a team of researchers to understand, firstly, how we can support participants to engage with the online programme. But secondly, and hugely important, is to understand the impact of the programme on participants' mental health and wellbeing outcomes. Another element that we're going to be working on is the delivery of balancing stress in person in our local communities. So that might be in our local community centre, our GAA clubs, our libraries. And that's a hugely important next step for us, because we know that online isn't for everyone. So, it's important that we provide a suite of offerings as part of this stress management work that we're doing.
Yeah, and I think you can't get away from the fact that, like you say, the online doesn't suit everybody, and that face-to-face is still so important. We just assume you can do everything online, and that's not necessarily. It might be a different age cohort. There might be young mothers, there might be older people. So I think that's really important that you're going to develop that. So Alicia, you've just explained to us what's the next steps for balancing stress. And as we said, it's really important to have that face-to-face as well. And we're coming to the end of the episode just now. So what would be the key takeaway, Alicia, do you think, for anybody listening today?
I suppose I would say the programme is for everyone, whether you're working, whether you're raising a family, or just trying to navigate the ups and downs of day-to-day life, or perhaps it's a combination of all of those things. stress is a part of our life. I think to have the goal to eliminate stress from our life is pretty much impossible. And I suppose rather than trying to eliminate it or to avoid it, you can find practical ways to manage it and ensure that it doesn't take over. And I think that's exactly what we're trying to do with this program, is to give, the general public practical tools to balance stress in their lives.
Oh, thank you very much. And for you, Niamh, what is I know it's difficult to put into one, so you just tell the audience what you think is the key things that you would like them to take away.
Yeah, and it's always hard for me to pick out one thing, but I suppose, as Alicia said, everyone gets stress. This is for everybody. Don't suffer on your own. Please don't suffer on your own. Stress is a natural part of life. It's to be expected, but that doesn't make it easy or it doesn't make it pleasant. It's important to have skills and strategies. And this is where this program is really useful, because it's a practical tool for all of us to use. We know that there's a huge financial cost to the state, to society, when people are stressed, because when you're stressed, you have anxiety, depression, low mood. But more importantly, and what should be highlighted, is there is a human cost, the cost of suffering when people are stressed. And life's too short, I would say. I think we'd all agree. And we owe it to ourselves, I suppose, to prioritise ourselves for those who care about us in managing and trying to balance our stress. We would hope that this program is so universally used. That would be the greatest success for balancing stress, that if you went into your GP surgery, the link would be on the wall. You go to your local library, to your sports club, click here for the Balancing Stress program. In HSE services, it might be the first step of a tiered intervention. So while you're waiting, whether you're waiting for one-to-one or group intervention, you'd be sent this link to help you while you're waiting. It can be used in many, many different means and mechanisms, as you said earlier, for schools, for leaving cert, to share this, because parents get equally as stressed as their children do when you're doing leaving cert. I have a son who's in his final year or pre-final year in college, and I could see the stress with him. And we were talking about balancing stress the weekend and just understanding what happens to your body and how the stress hormone is released. And that the symptoms you experienced are because your body's actually trying to alert you to a difficulty and help you to try and solve it. So I think for me, don't suffer on your own. Share the link, reach out, and there's always help.
Yeah, thank you very much, Niamh. Those words are very wise, and I think we could all follow those. So to our listeners, that brings us to the end of today's episode. I'd like to thank our guests, Dr. Niamh Clark and Dr. Alicia Clark, not related, by the way, for really sharing your insights on managing stress and how the Balancing Stress program can and hopefully really will make a difference to people. If you or someone you know is feeling overwhelmed, remember that support is available. You can go to yourmentalhealth.ie. The Balancing Stress program is free, it's evidence-informed, and it's designed to fit into your daily life. You can complete it at your own pace, as we've been told, in your own time, on your chosen device. And to start your journey towards better stress management, please go to HSE Balancing Stress. Thank you for listening to the HSE Talking Health and Wellbeing podcast. And please share with any of your colleagues, friends or family if you feel they would benefit from this.